Welcome to Tinnitus. Okay, what we're going to do, we're going to cover a couple of things, and you're going to see and again, this is going through the medical worlds, what they think is going on, what's actually happening, and the solution for it. And there's such a difference in reality. But also, what we're going to delve into is a lot of people think sound comes from the ear. And it really doesn't. It comes from a perception of your mind. And when you're looking at all of the studies on this, you're going to find out a lot of them involve tinnitus in the right ear. No, not the wrong ear. I know what you're thinking. No, the right as compared to the left. Oh, God, some people. Okay, but so why is it the right ear, mainly? And so you start looking at these studies and you start to think, maybe it's not involving the structures that perceive sound. Maybe it's involving some other neurologic aspect. And so this is, so I just want you to have that in mind, that the tinnitus is not covering just the aspect of the anatomy and physiology that perceives sound. It's something beyond that. But, let's go into the American Tinnitus Association. Tinnitus is the perception of sound when actually no external noise presents. It's commonly called a ringing in the ears, and it can include buzzing, hissing, whistling, swooshing, and clicking. In rare cases, people can even hear music. Okay, now it can be acute, temporary, chronic. Now, this is one of the most common health conditions in our country. We're talking millions of people. 50 million Americans had it at least some form of tinnitus. Now, we're looking at 1 in 5, so 20% of our population has it. Now, it can be debilitating, because if you have this irritant, this chronic, okay, your fight or flight's going to be initiated, so it's going to wear you out, fatigue, stress, sleep problems, obviously trouble in concentrating, depression, anxiety, and so, but where's the cause of it? Now, the causes of tinnitus, and this is where it shifts. They're not taught critical thinking in medical school. Okay, so when you say somebody has a ringing in their ears, but there's no sound present, they think that it has to do with inner ear cell damage. And we're going to go over the anatomy of it, but there's a seashell type structure inside of the skull called the cochlea. And it has little tiny hair cells in there that vibrate depending on the different frequencies, and then you hear like low or high frequencies of this. And they think that there's a damage in there, and then when the hair cells are damaged, this triggers the ear cells to release an electrical signal through a nerve from your ear, the auditory nerve, to your brain, and your brain interprets these signals as sounds. If the hair cells inside your inner ear are bent or broken, they can leak random electrical impulses to the brain, causing tinnitus. Now, they think it's from common causes: age, loud noise, earwax blockage, and bone changes, or it's called otosclerosis, where the bones, and you're talking the smallest bones in the body, and there are really just 3 ones, the malleus, incus, and stapes. But when we look at it, there's medical causes, okay, and we're talking medications and chemicals. Antibiotics, chemotherapy, and I know you're going to find the shocks, or shocks are like incredible, that there's over 650,000 people taking chemotherapy. Diuretics, okay, that's a blood pressure drug and commonly given for people who have swelling. Quinine medications, tricyclic antidepressants, and aspirin and other non-steroidal anti-inflammatories. We're going to go through each one of these, but I want you to think of, remember now, do these damage the cochlea, or the actual physical structure, okay, or do they damage and alter brain function? Now, antibiotics, we're going to hit this one first. Now, this is according to the CDC. Now, these guys are known for being pro-drug and pro-shot. They say out of the 154 million prescriptions for antibiotics, 30% are unnecessary. Okay, so you're talking you're talking 50 million prescriptions unnecessary. Now, 44% of the outpatients were for acute respiratory conditions that aren't needed either. Of these, approximately 50% of antibiotic prescriptions may be inappropriate. Now, if you're taking an antibiotic, you should have a life-threatening situation. Every time you take an antibiotic, it increases your risk of cancer. Antibiotics are incredibly powerful, incredible life-saving, but if you use them for something that's not life-saving, it can damage you. Now, if you're not taking antibiotics and you're eating commercially produced food, this is where you're getting therapeutic doses of antibiotics. So just a standard feed can do this. So what happens if you have to take an antibiotic, or you've taken an antibiotic in the past, or you've been exposed to toxic food? I know, your friend said, hey, let's go to Carl's Jr. I know, I saw the commercials too. Jesus, I wanted a burger too. Okay, so you go there. Has anyone seen the Carl's Jr. burger commercials? Okay, good, thanks. I want an amen there. Okay, so what you do is you have to optimize your gut flora. Okay, so organic plant-based diet, healthy fats, coconut oil, fermented veggies are so good. You're going to see that replaces healthy bacteria in your gut. And there's even a study, because when you look at the gut bacteria, this is what produces the B vitamins, B12 in particular. And this is vital for the nervous system. And you're going to find out that the nervous system is one of the, or neurotoxins, is what causes tinnitus. So when you look at fermented veggies, think of the healthy bacteria which literally produce the B vitamins, which helps your nervous system work. Juicing vegetables, blending fruits, raw dairy, and reduce omega-6s. Now, this is so easy to do. This is what they used to do, fermenting foods. Check out our videos on how to do it. It's so simple. You chop it up, you put it in a jar, sprinkle some salt on it to draw the moisture out of it, and if there's still dryness, put a little bit more moisture in there and set it on the counter for a week to 10 days. Kefir, sauerkraut, pickles, miso, kimchi. Now, so you got to repopulate your gut if you've been exposed to antibiotics. Cancer drugs. And this statistic, when you're doing research, because we get a lot of people that have gone through chemotherapy and then we get them on natural stuff and, work on their cancers. 650,000 people a year are getting chemotherapy. That statistic just blew me away. Now, we're not even going to go into whether chemotherapy is effective or not, or just poisons, or causes secondary cancers, or any of that. Okay, we're just talking about tinnitus. Okay, now chemotherapy drugs, and this is the American Cancer Society, target cells at different phases of the process of forming new cells. It's called the cell cycle. However, chemotherapy drugs can't tell the difference between healthy cells or sick cells, cancer cells. This means that normal cells are damaged along with cancer cells and causes effects. I mean, a few months ago I saw this one commercial where this fireman is with this one kid who recovered from one cancer, but now developed another cancer from the chemotherapy. Please send money for little Billy. And it's just like, gosh, strengthen his immune system. Okay. Now I want you to look at the causes of the chemotherapy cancer drugs. Now these are so toxic they can cause secondary cancers, and they have to balance them because they will kill the patient, okay, if they give too much. Okay, nausea, vomiting, weight loss, mouth sores, dizziness, headaches, tingling, burning, inability to move muscles, painful urination, joint pain, jaundice, liver problems, dark urine, coordinates, balination, seizures, mood changes, depression, and ringing in the ears. Okay, now cancer is actually a disease of metabolism. It's not virus, fungus, or bacteria. It's a lifestyle that you're choosing that makes it grow. I encourage everyone to read Cancer as a Metabolic Process. This is a new era will emerge for cancer management and prevention once cancer becomes recognized as a metabolic disease. It's like scurvy. It means that if you change the nutrient intake and you change the toxicity or deficiency, you can reverse cancers. And we see it all the time. Now, diuretics. Now, we had an incident Friday of where one of our patients, now this guy's a big guy, built like a tank. He's 6'2", he's about 80 pounds overweight. And he got off all his drugs a while ago, but his legs started to swell, okay, and he stopped exercising, and his diet and nutrition got poor. So he goes to the doctor, and the doctor said, gee, you need some diuretics to fix the swelling in the legs. Now this causes the kidneys to work harder, removes a lot of the minerals out of the body, particularly potassium, and this can actually cause cardiac arrhythmia. So what did he get? Cardiac arrhythmia is the same day he was taking this stuff. Okay, and so then they gave him a beta blocker. Okay, good, thanks, doc. This dropped his blood pressure because the diuretics are a blood pressure drug and the other one's a blood pressure drug. And when you're 80 pounds overweight, you kind of need a lot of blood because you got, you know, for every pound there's like a mile of blood vessels. Okay, so his blood pressure went what? Survey says? Okay, good. Went to 50 over 30. He almost died. Went ashen. They rushed him to the hospital. Took him 2 days to raise it up. Okay, now, dangerous. And this happened this weekend. Okay, now, are diuretics dangerous? Yes. Okay, they're called the water pill. Water doesn't come in pill form. Okay, typically comes in a glass or a jar or a stream. Okay. So when we look at this, now these stats, it's hard to find stats on drug use. The best one that we could find was 2003. So this is 13 years ago. Do you think drug use has gone up or down in 13 years? Up. Okay, good guess. Okay. At the time, you're talking 19% of the adults from 18 and older. Okay, that 13 years ago was 217 million. Now, 45% of these adults used a diuretic. That was over 18 million people in 2003. Now, our population's increased, okay? So you're looking at possibly between 20 and 25%, okay, of the people, or 20 to 25 million people are using diuretics. So it is dangerous. Now, let's look at the side effect of the diuretic. So we just read the side effect of the chemotherapy drugs. Okay, now here's the side effect of the diuretics. Low potassium, so uneven heart rate, no problem, beta blocker. Okay, thirst, increase, I'm kidding, by the way. don't take, okay, leg discomfort, muscle weakness, severe pain in the stomach, nausea, vomiting, trouble concentrating, memory loss, easy bruising, unusual bleeding. God, easy bruising, does that mean that the blood vessels are stronger or weaker? Oh, so does that mean an increase in stroke from taking the water pill? Yes, okay, so, oh, and ringing in your ears. Okay, Now, if you do have swelling, and let's say you do need a natural diuretic, okay, dandelions, and they actually taste good too, but we have a number of different herbs, hawthorn berry, horsetail, juniper, green and black tea, parsley. I mean, you know, I just had a salad the other day. Parsley, cucumber, and avocado. Oh, baby. Okay, and hibiscus. Now, let's look at quinine. And this is one of the most common medications that they're using around the world. We're going to do another follow-up on Zika virus, okay, because even though people aren't looking at the facts, the panic is still there. Okay, well, maybe that's why, because if people were looking at the facts, the panic wouldn't be there. Okay, so we're going to bring up the facts on that, but you're talking 200 to 400 million doses of quinine given in Africa. Okay, now, is this the only therapy for malaria? Don't answer yet, okay, because we're going to go over natural protections. But over 100 million courses are used around the world. Now, this is for quinine, so you're talking 500 million, almost half a billion doses going around the world. Fever, chills, confusion, weakness, sweating. Doesn't that sound like an AIDS diagnosis? Okay. Problems of vision, hearing, trouble breathing, fainting, easy bruising, unusual bleeding. Ebola! Loss of appetite, okay, confusion, depression, and ringing in the ears. Okay, when I'm reading this stuff, I know it's kind of sick, okay, but everybody knows that 12 days of Christmas, 5 golden, and a partridge in the pear tree. You know, it's like it's at the end of everything. It's the same type of negative toxic reaction. Okay, so we really have to wake up with what we're putting in there. Now, natural alternatives to treat malaria. So if you're going to Africa, if you're going to a malaria-infested region, grapefruit. Yeah, a couple of grapefruits a day. Fever nut. There's a couple of natural, like sweet wormwood, cinnamon with pepper and honey. That makes a great mosquito repellent too. Lemons and limes, holy basil, high doses of vitamin C, large intakes of fresh fruit. What does this do? It strengthens your immune system. You have someone with a healthy immune system bitten by a mosquito containing malaria, it won't grow. His immune system protects you. So this is where immune systems are supposed to thrive, okay, in environments if you give them appropriate nutrients. Now, antidepressants. This is insane. 1 in 4 women aged 50 to 64 are taking an antidepressant. Now, this is not, and in all cases, a medical condition. You're talking, it's the most consumed class of drugs in the U.S. So are we nutrient deficient, toxic, or do we all have a medical condition of depression and anxiety? 1 in 10 Americans has taken an antidepressant, 270 million prescriptions. Let's look at the side effects of, or the effects of these drugs. Coma, seizure, hallucinations, delusions, disorientation. No, these are not the reasons to take it. These are what the drugs cause. I want to be clear. Okay, so peripheral neuropathy, tingling, numbness, involuntary movements, anxiety, insomnia, nightmares, drowsiness, dizziness, fatigue, and the tinnitus in the tree. Okay, and tinnitus. Okay, you gotta, it's sick to make a joke of this, but you gotta look at this as, my God, why are people prescribing this when there are healthier alternatives? What are natural treatments? And check out our videos, natural treatments for depression. You're talking within 30 days by changing the diet, proper exercise, healthy amounts of vitamin D3, omega-3s, optimizing your gut flora. You need healthy bacteria in there, and proper sleep. Now this, non-steroidal anti-inflammatories, aspirin, 70 million prescriptions of this stuff are written each year in the United States. We're talking 30 billion doses of non-steroidal anti-inflammatories. Okay, there's a little bit over 300 million, so that's about 100 doses per person. I'm not taking any. Someone's making up for me. Do you know what I mean? So this is the aspirin a day. And they had the audacity to name that little poisonous thing, the aspirin, the baby aspirin. Even though it says on the bottle, don't give it to babies. Okay, you know, for what? Thinning blood? What's that combination of what, oxygen and hydrogen? It's H2O. Okay, so water. Thanks, Doc. I know, I was getting confused there. Okay, water is a good blood thinner. Okay, you don't need a toxic chemical. Now, when we look at this, what are the effects? And we're talking ibuprofen, Motrin, Aleve. We're talking, you know, aspirin. Black and bloody tarry stools, coughing up blood, vomiting, severe nausea, stomach pain, fever, swelling, chest pain, shortness of breath, slurred speech, severe headaches, neck chills, sensitivity to light, seizures, convulsions, hearing problems, and ringing in your ears. Okay, so what I want you to look at this, also, it says it on there. Now, this is what's crazy. The kidneys regulate blood pressure the size of your fist. So every 20 minutes, you got about 6 quarts of blood flowing through here. Renal papillary necrosis means part of that kidney is damaged. So if you have to get the same blood through a kidney that's damaged. I'm sorry, I got that music thing. Am I the only one that just heard Louis Armstrong? Okay, good. Thank God, man. Flashback, and I never did acid. So when you look at it, you got damage to the kidney, you got less surface area. So what has to happen to blood pressure in order to get the same blood pressure or blood through a damaged kidney? It has to do what? It has to go up. So let's say you're taking the baby aspirin today for a healthy heart. Then you got occasional joint pain, so they're adding the Motrin. You take that for a few years because it has an accumulative dose. You damage the kidneys. There's no sign of kidney damage until about over 80% of it's gone, and your blood pressure magically goes up. So then they give you the water pill to lower it down. Okay, are you following me? Yeah, and this is modern science, evidence-based medicine. Okay. Skin issues, exfoliative dermatitis, Stevens-Johnson, toxic epidermal necrosis. This is horrible where the skin literally melts off the body. Now, cardiovascular warnings. Oh, I'm sorry, what were they giving the aspirin for? Heart stuff? Non-steroidal anti increase the risk of serious cardiovascular thrombotic events, myocardial infarction, and stroke, which can be fatal. This risk may increase with duration of use. So if you're taking an aspirin a day, you cannot stop it. It's extremely dangerous to stop it. Talk with a real doctor, not the bastard that gave you the drug in the first place. I mean, a real doctor that understands it's toxic. I didn't just say that, right?
No.
Okay, good. Okay, somebody that understands anatomy, physiology, neurology. Okay, so they slowly wean you off of it by getting you on healthy nutrients.
How that profession is called?
Chiropractors, or naturopaths, or homeopaths, or there's a lot of chiropractors that want to prescribe drugs now too. So we're talking to real doctors. These are even medical doctors that are smart now too. Yeah, so they're going to call a diuretic, not a water pill. Gastrointestinal adverse events. These serious adverse events can occur at any time without warning symptoms in patients treated with it. What are they? Inflammation, bleeding, ulceration, perforation of the stomach, small intestine or large intestine, which can be fatal. Why would you prescribe this? If you want natural pain relievers, I put them on your sheet. Okay, I would think that you got a red light, warning light on the car, find the source of the pain and then fix it. Okay, omega-3s, boswellia, curcumin, cayenne cream. If you've ever done cayenne cream, it's really wild. You mix cayenne pepper in like an ointment, like coconut oil or something. If you have any small cut on your body, you'll find it. Yeah, don't do it on cuts. You'll wish you didn't. Okay, vitamin D3, great pain reliever. Astaxanthin, ginger. This is all in your handout. It is. Okay, so let's look at the structure. Okay, now, if you've ever done dissection, and let me tell you, I've dissected hundreds of bodies. This is embedded deep in bone. And I've tried, for an hour trying to scrape the bone around it. Very, very difficult thing to dissect this. The ear ossicles, very, very easy. But the cochlea itself, this curlicue shaped, that looks exactly like a sea snail, is amazing. But I want you to appreciate what this is like. Okay, you've got this eardrum, tympanic membrane, the malleus, which means hammer, attached to the incus. So sound hits this, vibrates that little malleus, that hits the incus, and then that transfers these vibrations through that little horseshoe-shaped structure. And this vibrates the fluid inside of this conical-shaped structure here. And then depending on which hair cell is going to be stimulated, you hear a high, a low, or your brain interprets that sound. I know. I'm just like in awe that this works. You know, because it doesn't seem that sound would be that sensitive, or that hammer hitting that incus would be that accurate to interpret such a variety of sound. God, what a cool species. But also, when you look at this is the eustachian tube, so this drains in the throat. So you can see, and this eustachian tube drains through the soft palate in the back of the throat. This is where middle ear infections come from. Okay, they're not infections, they're ear effusions. And the nerve that supplies that muscle doesn't function correctly, and the tube closes off, the ear fills up with fluid, and it gets red, bulging, and inflamed, but it's not infected. We're talking over 90% of ear infections are actually ear effusions. Another reason you shouldn't take an antibiotic. You get the upper neck adjusted and the ear drains. But so now when you look at this, we've got this apparatus on the outside. And what those are, they're semicircular canals where you get a canal or a circle like an Olympic ring running in this fashion, one running here and one running here. And what those Olympic rings do, when you tilt to one side, there's little hair cells and rocks in there that float down with gravity that tell you where your position in space is. And this is why positional vertigo, we're actually going to go on a couple of different vertigo problems in the future, but these canals we're going to dissect in detail. They're phenomenal. It's just, I want you to understand that this is how the brain interprets sound. But also, when we look at this, if a very loud noise hits this, it can actually damage those delicate structures. And this is why you can get a consistent ringing. Now, when I was 17, I was an apprentice, a carpenter. And let me tell you, if you had a job when you're 17 and making good money, you would do anything these guys would ask. So, I mean, I would carry lumber, anything else. They gave me a stud gun, which, has anyone ever used one? Okay, yeah, you load a 22 caliber bullet in there or 32 caliber. You put a nail in the head, you push it down on the ground, you turn your head and go BAM! Okay, now, of course, we didn't have eye protection or ear protection, and I'm not going to ask because I was a new guy on the crew, and by God, if they said to do it, I'm there, man. Okay, so I wrap a bandana around my head, okay, and I figure, well, I got 2 ears, I could do it with one. 300 feet of this for 7 hours, okay, and I noticed a ringing in my ear, but what was interesting, it only lasted about 3 weeks, okay, and then it went away. So the ear, this is, not only can it be damaged, but it can heal. Now, this is interesting from Harvard. Now we're getting out of, yes, chemicals do affect it, but it's more than, because you got to figure, the medical world is saying that it's a problem with this. However, the chemotherapy, the non-steroidal anti-inflammatories, the quinine, okay, the antibiotics, they all affect it too. So are they affecting the cochlea? Not really. And so Harvard comes up that most tinnitus is sensory neural. This means that it's due to hearing loss at the cochlea or cochlear nerve level, and I disagree with that. Okay, now our bodies produce sounds called somatic sounds that we usually don't notice because we're listening to external sounds, that anything that blocks normal hearing can bring somatic sounds to our attention. Now this is true, but I disagree with the cochlear nerve thing. Now what I want you to do, if you have good hearing in both ears, you're going to pick one ear, okay, and what you're going to do is say 1, 1, 1, 1, 1, 1, 1, and close off the ear. Okay, 1, 1, 1, 1, 1, 1. See how loud it is in that ear? Okay, now, this is the cool part. And this is what we'll do to test hearing. I'll actually have a vibration or a tuning fork, and I'll put it on top of a kid's ear or head like this, and I'll say, okay, now close off one ear. And they'll hear it in the ear they closed off. Now what's interesting about this is this can test nerve damage, because if you have actual nerve damage, you're not going to perceive it in that ear that's affected. If you have a sensory problem that's not related to the nerve, so this will test nerve sufficiency. You block up the ear, your brain is receiving the sound from both sides, okay? However, it receives it to the side that you close off faster because it's traveling through the bone to get to that nerve and not through the air to get to that nerve, okay? And just like in the Old West, where they would listen to the railroad track to see if the railroad track was coming, because sound travels faster through a solid than it does through air. So what you're doing with this experiment, you're just seeing how fast it comes through the solid, which is the bone. Isn't that interesting? I think it's really cool. I like humans. Okay, so what they're talking about, and this is the McMaster University, is loud noises can negatively affect it. And consistently, when you remember, look at that cochlea where they got the wide hair cells and smaller and smaller and smaller. If you're working with something with a high-pitched or a monotone sound, you're going to wear out that area. So if you have a monotone spouse that's yelling at you all the time, why didn't you pick up the... Okay, that's going to wear out that area and you won't hear them Thank God. Sorry, dear. I didn't really not hear you. It's just my part of my cochlea. Okay. Okay. Now, when we look at this, so protecting your ears is a good thing for sure. It can regenerate without a doubt, but chronic stress and tinnitus, now you're thinking this is unusual. A close link between tinnitus and stress, such that stress may make tinnitus worse and vice versa. Emotional exhaustion, feeling drained, chronic stress predictor. Wow, and this is out of the Journal of Psychotherapy and Psychosomatics. Chronic stress may be a large risk factor for developing tinnitus as exposure to occupational noise. So now you've got the three stressors, physical, chemical, and emotional stress. How are these related to tinnitus? Do you want to know how? It has to do with brain function, not just the sensory perception of the ear. Now here's a patient, and I actually really like this guy. He's cool. Okay, comes in a few weeks ago. Now this is him standing up straight. This is his list of chemicals that they've given him. Now we're looking at blood sugar, blood pressure, heart stuff, another blood pressure, okay, non-steroidal anti-inflammatory. So you're seeing a number of different drugs in here, and nobody knows what they do, but this is common. This is common in our society today, to give chemical on top of chemical on top of chemical. Nobody knows, honest to goodness, what Carovidal and does with diazepam, and does with Januvia, and does with metformin, and does with atorvastatin. I mean, nobody knows what this stuff does. And then I'll tell you, for God's sake, don't take the aspirin, okay, with the tamoxifen, okay? You know, because if you're taking the aspirin, it's going to give you spurred speech, and you can't really say this friggin' thing, okay? No, you know, I mean, it's just psychotic that this would be considered medical therapy. And I'll keep you abreast of what's going to be happening with him. But when you look at it, this is what he came in with. Low back pain for 10 years. And nobody ever fixed it. Nobody ever fixed it. But what does chronic pain do to digestion? It messes it up. What does it do to blood sugar? It elevates it. What does it do to blood pressure? Elevates it. So right here, for 10 years, he's been going to doctors, and they've been drugging him instead of fixing him. Okay, that shouldn't just piss off me. That should piss off everyone, okay? Because this is not appropriate. It's not respecting the human being, and by God, we got to respect the human being. This is what your body requires. When we talk about curing tinnitus, get the nervous system checked, for goodness sake. You've got to do regular exercise, proper nutrition. We already gave you a number of different choices. Sufficient rest, vital for regenerating, and prayer and meditation. Free radicals. Now, remember, there's always a charge around. If a molecule is missing a charge, it's a free radical and wants to attach, and this is why smoking and toxic chemicals and things create tissue damage. They're called reactive oxygen species, or ROS, implicated in the pathology of inner ear and peripheral and central nervous system pathways. And they detected high serum values of these free radicals in patients with idiopathic, which means root word idiot, we don't know where it comes from, tinnitus. Antioxidant therapy is good. So if you work in a toxic environment, or you've had toxic exposure, okay, should you be doing antioxidants? Yes or yes? I mean, absolutely. It just makes so much sense. Now, zinc, and this is vital. 3 possible mechanisms have linked zinc to tinnitus. Cochlear, the SOD, synaptic transmission, and depression. When we look at this, there's the vestibular ocular nerve. Now this is one of the cranial nerves that comes out on the top of the medulla. And zinc is an essential component of the superoxide dismutase, or the SOD, in certain enzymes that's important for proper function of the immune system. So what's zinc-containing foods? This, we're talking kefir, lamb, chickpeas. Who doesn't like hummus, for goodness sake? Pumpkin seeds, cashews, cocoa powder, please, dark chocolate, baby. I mean, when you look at this, we're just talking healthy nutrients. And so it's not that hard. Melatonin. Okay, and I love this one. Melatonin is associated with statistically significant decrease in tinnitus and improved sleep quality. So when we're talking good levels of melatonin, what reduces melatonin? Blue lights, TV, computer, iPad, cell phone. Okay, so if someone's saying, well, look, doc, I eat healthy, I don't take drugs, I never take a non-steroidal anti-inflammatories, but I'm glued to that computer and I have crappy sleep. Enjoy the ring and answer the phone. Okay, I'm sorry, this is a solution. I'm done. Okay, you want to still watch the TV? Okay, look at the melatonin boosting foods. Okay, pineapples, apples, bananas, orange, sweet corn, rice, tomatoes. I mean, this is good stuff. And I'm sorry, this is barley like in the plant, not fermented like in the bar next door. Okay, B12. Now, B12 is interesting because there's a lot of foods that don't contain it but produce it. You need bacteria in order to produce vitamin B12. Okay, this is vital. So anything that destroys the bacteria, like the antibiotics, is going to cause a low B12. Now, and this is vital because when you look at B12, it's involved in the nervous system. These observations suggest a relationship between vitamin B12 deficiency and dysfunction of the auditory pathway. A statistically significant increased incidence of vitamin B12 deficiency was identified in patients with chronic tinnitus and noise-induced hearing loss. Okay, so when you look at it, no kidding, that's where the glyphosates come in, that's where the antibiotics come in, that's where the crappy diet comes in. So can we reverse tinnitus by giving healthy nutrients? Absolutely. Now remember, these don't contain it, but the bacteria in your system can produce it from it. Okay, so we're looking at sardines, grass-fed, cottage cheese, raw cheese. You can supplement with it, but there's so many different studies on the B vitamins, how they're absorbed in the ileum, how they're produced mainly in the large intestine, which is distal or further away from the ileum. So they think that some of it's secreted in bile. I mean, still to this day, we're still learning about how the body works. This is why a lot of animals that only eat grass, they get their B12 by eating their own feces. I'm not saying, we should do that, but supplementation is a good idea. Okay, chiropractic and tinnitus, and I love this out of the JMPT. The clinical progress documented in this report suggests that upper cervical manipulation may benefit patients with hearing loss. Now, multiple topics in integrative healthcare. Upper cervical spine manipulation may have a positive effect on hearing loss and tinnitus. This is one of the coolest articles. And I got to apologize for the wording on it, but me and my son found it, and I said, I got to have that one. Okay, and he says, Dad, look at how it reads. But, okay, now this is what stuff normally reads. The aim is to relieve pressure on the nerve roots in the upper neck, thereby reducing activation of the spinal tract of the trigeminal nerve. The C7 to T4 model proposed that the dysfunction of these vertebral levels causes joint fixation of pain. This pain alters the neuronal messages perceived, therefore sent by the central nervous system. Another model contends that the irritation of the vertebral nerve by cervical lesions can produce a sympathetic syndrome, giving symptoms of a headache, vertigo, visual disturbances, and tinnitus. Okay, in English, ha! I just stimulated the sympathetic nervous system. Okay, and so that can cause this. Also, dysfunction of the C7 through T4, that's the upper thoracic one. So what do you think happens when you're studying on a computer? What area do you think is strained? Absolutely, it's just like, oh my God. This is the pathophysiology of every office worker on the friggin' planet developing this tinnitus. I mean, amazing. This is brilliant too. Okay, now get this, and I love this. Ancient history says that chiropractic, the first adjustment was to relieve deafness. Now, any evidence of that today? Here's a study that examined it. The effects of one adjustment on the initial chiropractic visit on the central nervous system, documenting clinical changes of audiometry in patients before or after chiropractic care. Now, here you go. You've got all these patients were all classified as hearing impaired. They get set up, bam! Okay, and the guy walks away. 86% of the patients experienced either a dramatic improvement or complete restoration of their hearing after one adjustment. Bam, baby! I'm thinking, wow, I like that. You know, makes you want to be a chiropractor. Okay, so like there's a lot of people that say, well, it can't do it. No, it can. I mean, we understand how the nervous system works, and there's evidence of it. This is literally how to cure tinnitus. Okay, if it's from a loud noise, would antioxidants help rebuild it? Would nerve supply help rebuild it? So even if it's from damage from a stud gun or loud music or something else, you know, your body is so brilliant at recreating itself. Get the nervous system, exercise, nutrition, sufficient rest, and prayer, meditation. Your system is brilliant. Now, owner's guide, you get 7 days of it for free, but reference on top of reference on top of reference on top of reference. Ha ha! There you go, internet trolls. Ha ha! Eat my references. Any questions? Yes, sir.
Why does wax build up in your ears, and how do you get rid of it?
Oh, that's actually a really good question. That it builds up to keep everything moist and protective. Because you need wax to keep, you know, the skin healthy, and it's just kind of like a thick oil. There's a couple of ways you can do it. If you want to be fancy, you get garlic mullein oil from a health food store. You heat it up underneath the hot water. You tilt your head off to the side. You pour a couple of drops in there, and then move your ear around for a few minutes. And then goes little blue, like bulb-like things that you used to wash the kid's nose out with. Okay, and this is going to be a tough one, exact temperature water inside of it. And the only reason I say that is because if you have temperature water in there that's too hot or too cold, it can induce vomiting or dizziness. Because the temperature change that hits the tympanic membrane can alter your vestibular awareness. I mean, it can really cause dizziness and throwing up. Then you tilt your head down, wash it out, and then do it a couple more times, and you'll be clean as a buzz.
Body temperature water?
Air temperature. Yeah, and now also what's tough, you do not want to use a Q-tip, you don't want to use a paper clip, you don't want to use a pencil, you don't want to use your finger, okay, even though it's, I know this is like ancient knowledge, but people forget the name of the fingers. This is actually called pollicus, because police means strong. This is indicus, because you're indicating things. This is vulgaris, for changing lanes. This is annulus, because, you know, like the ring fingers. And this is actually called auricularis, for cleaning the ear. Okay, but that meant the outside. No, seriously, you know, when you're stuck in an anatomy lab for years, you learn stuff that's like, wow, I'll never use that. Yes, sir.
Can tinnitus be caused by something having to do with the teeth?
Yeah, absolutely. And that's going to be from a trauma. But the teeth and the TMJ, I mean, and this is one of the classes I used to teach, the temporal mandibular joint is intimately connected to C1. So you can never get a TMJ joint fixed unless you deal with the cervical component. And so you got to have that checked by somebody that's skilled in correcting it. Yeah, but absolutely. And but it's with any trauma with the spine, like they just went through, like a C7 T4, but that upper cervical, and that's why we had a couple of studies on upper cervical trauma, and that upper cervical, and that's the C1, that's intimately involved in the jaw, and the jaw is intimately involved in C1. It's really cool. I love the dynamics of that area. Yes, sir.
How much melatonin can you take?
How much do you produce?
Not sure.
Huh? Okay, no, because this is important. It's a total guess when somebody says, yes, you need 2,000 milligrams of vitamin C 4 times a day. That's a total lie. Nobody knows. Okay, so your body already produces sufficient melatonin given your environmental stimulus. Now, if you're trying to cheat and study on the computer or watch TV right before bed, if you're trying to cheat, you know, no, I'm not going to go along with that. Okay, because you're burning the candle at both ends. I'm with you on that because I like working too hard too. But, you know, start allowing your body to produce healthy melatonin levels by getting deep sleep. Check our sleep video out for causing deep sleep, and then your body's going to produce its own melatonin. Okay, so healthy juicing, healthy blending, organic vitamins, or organic diet, plant-based diet, just exactly what we're suggesting here. And your body will produce sufficient melatonin. Next week, we're going to be in Alaska, but the week after, bladder cancer. And you're going to see the causes and solutions and reversals. It's going to be really exciting. So thank you very much.